For an IM injection, you're going to review your orders, compare it to the MAR, identify your patient, perform hand hygiene, put on your clean gloves, perform, focused assessment, gather your supplies, compare your medication to the orders again, check your expiration date, still good for another 8 years. Off the top, clean with an alcohol pad. Drop your medication. Aspirate how much we need. I'm gonna do 1.5. Inject your air. Ooh, this needle is flimsy. Pull back our 1.5. Get them bubbles out of there. We got our 1.5. And then clean needles, unused, you can recap. You don't want your fingers at these ends because you still get a needle stick. But you can recap a clean, unused needle. And then we go back to our patient. If we didn't draw it up bedside, we would compare our medication orders with what we got again. And then choose where you're going to give it. We're doing IM. We're going to utilize the Z-Track method. We're going to do the ventrogluteal. So hand on the greater trochanter, thumb towards the pelvis, spread the fingers. So it would be about right here. Gonna explain to the patient what we're doing. You're getting an injection. It's gonna go about in your hip. It's probably gonna burn a little bit, and then I'll put a band-aid on you. You can take it off later. So we're gonna get our alcohol pad, cleanse in a circular motion. 3, 4, 5, 6, 7, 8, 9, 10. We're gonna let that dry for a second. Still with clean gloves, take our needle, bevel up. Using the Z-Track, you're pulling 1 to 2 inches of skin to the side. We're coming in at a 90-degree angle, bevel up, straight down, aspirate, okay, still holding, and then we inject slowly. About a milliliter per 10 seconds. Okay. Leave it just for a second. And then we can remove and release the skin. And then we would not recap a used needle. You would use the safety feature and then discard of your needle in a puncture-proof biohazard container. You could put a band-aid on there if you need to. Wash your hands, clean up. We're done.